Welcome to Global Med Talks, the podcast where we embark on a journey through the world of medicine and beyond. I'm your host, Haider Ali, and I'm excited to be a guide as we explore a diverse range of topics, from sharing personal experiences to diving into medical stigmas, controversies, and beyond. In some episodes, I'll try to bring on guest speakers, I'll try to dissect hot button issues, and share practical tips for navigating both medical school and life. Yo guys, what's up? So today I've got another episode for you. What makes a good doctor? And today I'm not by myself. I am with Umar. Umar, introduce yourself.
Hi guys, my name's Umar. As I just said, I'd just like to say before we begin, it's an honor to be on the podcast. I've heard so much about it, and so to finally be on it, it's one of my, let's just say, one of the topics of the bucket list has been ticked off now.
Thank you for that, Umar. You made it out to seem like it's like your lifelong dream, yeah, and like I'm already a famous podcaster like Joe Rogan. But anyway, thank you. I brought you on today because I wanted to talk to you about what makes a good doctor. And to be honest with you, personally, I think you're going to be a very good doctor in the future. So I wanted to see what your thoughts were about this topic. So without further ado, we'll get started. I just wanted to have a small talk about, you, who are you, and so the audience sort of know who you are. So if you can just introduce yourself, what do you study, what year are you in, which country do you study in, and why you chose medicine in the first place.
Hi, so essentially, I'm a third year medical student. I'm in my sixth semester, which means that next semester, so in March, I'll be starting my clinicals. That's also the halfway point. I'm studying in Georgia, Tbilisi, same city as our host, Heather. Originally, I was in Ukraine. That was for around 1.5 years. However, unfortunately, obviously, due to the war, I relocated along with many other students to various universities across the world. I ended up choosing Tbilisi, as did Heather. I feel I made a good decision. Hopefully, within the next 3 years, when I eventually do try and apply back to England, I'll really see if I made a good choice. Sorry, so with regards to why I chose medicine, I always joke with my peers and my friends that it's not actually something I chose, rather it's something that I was forced into. I come from a family of academics, and so my uncle's a lawyer, my father's got a chemical engineering degree. I wanted to go into law as well, but my dad, as I'm sure many students can, I don't know, sympathize with, they were told to go into medicine, and so it's something I fell into. However, 3 years in, I am enjoying it, and so yeah. Sorry to go on, but that's about it. Yeah.
That's a good thing that you're enjoying it now, because a lot of people never really enjoy it. And I've personally met up with doctors, and I've asked him. There was a GP in Preston. I asked him, so like, why did you choose medicine? Why did you become a GP? And he looked at me and he shook his head. He goes, you know what, parents, I don't like this at all. And even as a doctor, he didn't like it. I was like, wow, that's crazy. So when you're saying you're finally enjoying it now, I mean, I don't know how true that is. It probably is, because you do seem very motivated in your academic studies. So that's a good thing. That's a good thing, honestly. I mean, in regards to the whole parents thing, I think that is a lot of it's a trap that a lot of Pakistani and Indian students fall into. Not even Indian students, I think Arabs as well. I feel like there's a lot of cultures out there that fall into this trap. I don't really know how to overcome this trap. I guess parents should be more open and honest to their daughters and sons and just allow them to pursue whatever they want. Because I don't know if you agree with me, but it does impact the child a lot in a negative way. If they get forced into doing something that they don't like, and then ultimately they're not exactly going to perform as well. And medicine is just one of those things where you have to want to do it. You know what I mean? Because if you don't want to do it, then you're
Yeah.
gonna fail or you're gonna struggle. I mean, luckily for me, I got told to do medicine at the start, but then my passion grew when I was in PA school in UCLan. So I started off medicine, and I had this mentality that I wanted to become a doctor, and I had my own reasons, and I highlighted all these reasons in my first episode. So if you want to go check that out, I'll drop the link, or you can just probably go to my page and find the first episode there. Yeah, no, medicine's a great profession, man, and to be honest, I'm glad you're doing it. I feel like you would become a good doctor.
Thank you.
No worries. So, talking about a good doctor, what are some things that you think that makes a good doctor?
So I think one of the most important aspects of being a good doctor is definitely empathy. I feel it's one of the
Yeah.
most important skills in medicine. Definitely.
No, yeah, absolutely, absolutely. It is important, because as a patient, they are vulnerable and they're looking up to doctors at that point, and they're like, oh, we sort of need help, and they're very sad and they're vulnerable at this point. And if you don't show empathy, then it's not gonna help. So I feel like empathy is a good, and communication as well. The way you communicate with patients, and that's very important. And I mean, the whole reason I've started this podcast is because I want to improve my communication skills. And I'm thinking about my future. I want to become a good doctor, and I've been told by so many different people that you have to be able to communicate with patients, because patients are going to be difficult. Communicating with a normal person like I'm communicating with you, it's easy. But when there's emotions involved, you're going to be dealing with sad patients, angry patients, excited patients, and you have to be able to navigate yourself, and just knowing how to communicate with different patients in different settings and stuff. So yeah, no, that's a very important thing. So guys, as a doctor, you need to be a good communicator. Another thing I wanted to add as well, I was going to say knowledge and lifelong learning. I think that plays a big role into a life of a doctor. So you need to be able to study at an older age, like when you're 28 or 29 years old, because it's you're constantly going to be learning stuff. That you're going to have exams, um, and there's going to be medical advancements in the field, and you can't be lazy. You have to be motivated and constantly learning, and if you're the type of person that doesn't really like to study, and then, well, medicine's not for you.
Yeah, no, I completely agree. I feel the idea of lifelong learning, it's in medicine, it's not really a choice. It's more so, I'd say, a responsibility for the doctor. There's always new research and treatments and even technologies constantly coming out. And so it's crucial for a practitioner, not only a doctor, even a nurse, a medical researcher. It's important that
Yeah, yeah.
they keep learning, because obviously there's always something new out there that can improve the way you work, the way a patient recovers. So it's important
Mhm.
to stay on top of that.
Yeah, I mean, it's a good thing that you mentioned the other professions as well, because another thing I wanted to mention was to become a good team player and a leader. You sort of need to be both. And I remember I was in college, I was preparing for my medical school interviews, and they asked me, okay, so Heather, what do you think, what's more important, a team player or a leader? And I was thinking leader, because obviously we put doctors in this really high position, and you think they're always leaders, but that's not always true. Like, doctors have to be team players and a leader at the same time. So, and that's to obviously provide the best patient care for people and to provide an holistic care for the patient. So, yeah, no, that's also important. What do you think you are? Do you think you're more of a team player or a leader, or do you think you're a bit of both?
I mean, I feel myself, I take more of a laid back approach to things in life, and so I'd rather be part of a team as opposed to being a leader. I mean, that's just my personality in that sense. I'm sure you can agree. I'm not much
Yeah,
of a
yeah.
leader. I like to contribute towards overall results. However, I'm not necessarily the first person that take the first step towards initiating something.
But do you think that's something that you could improve on?
Yeah, I mean, most definitely. I'm aiming to be more in an emergency medicine type of role once I graduate, and so speaking from experience, as I have a sister who's a nurse who's also in the emergency department, it's important
Right,
for a
okay.
person to take a central role and be making decisions, because if everyone's just stood there looking at each other,
Yeah,
nothing's going to come of
exactly.
that. And so it's important for someone to take charge, and then teamwork comes into play, where we've got anesthesiologists or physicians or whoever is involved in making the correct diagnosis and treatment of a patient.
Mhm.
So yeah,
Yeah,
it's
yeah.
something I can improve on.
Definitely, man. Definitely. I mean, that is very, that's very important that you need to improve on it. Um, what about problem solving skills? Like I was thinking that as doctors we need to have good problem solving skills because there's gonna be some difficult situations. It's inevitable that you're gonna come across situations like that, and it's important to have the capability to solve them effectively by taking the necessary steps. And if you don't have this skill, then like you said, people are just gonna be stood there looking around, staring into space, not knowing what to do, and then it's not exactly the best approach to handling things. Um, yeah, the next point I wanted to cover was it's not exactly something people say quite often, but a positive attitude and professionalism. And I'm mainly focusing on this positive attitude point because if you bring good vibes to a ward, and then it sort of links in between to becoming a team player as well, because then everyone can come together. You're gonna have effective communication. People are not gonna be hesitant to approach you. You have to be that person that anyone could just come up to you, ask questions. You have to be approachable. People have to trust you, and like positive vibes, like it can positively impact like the whole your environment that you're in as well, and their worth ethic, which will benefit you and the team and ultimately the patient too, because if you all work together, then it's better for the patient, don't you think?
Yeah, so I mean, everyone knows this through media or TV shows, whatever. But medicine is very demanding, both physically and emotionally. I mean, just look at the long shifts, the difficult cases you're
Yeah.
faced with, the high pressure environments, not only from patients but even administration about seeing a certain amount of patients in an hour, effective feedback from patients. All of that goes into contributing towards a more negative aspect of medicine. And so it's important to keep a positive
Yeah.
mindset. But that doesn't necessarily mean, ignoring challenges. Instead, you need to incorporate other factors like, I'd say, resilience, and like you mentioned, problem solving. That's crucial as well.
Yeah.
You need to incorporate all of these aspects, and I think they all work towards having a positive mindset, because I think it's important in a few different ways why positive attitude, why it matters in medicine. I mean, you've mentioned a few in the past, like for example, I think you mentioned it improves patients' trust and recovery. Do you want
Yeah,
to
yeah.
talk a bit more about that?
I mean, yeah. So there was one example that I remember ages ago when I was like in UCLan doing some clinical placements, and what happened was there was this patient who didn't really understand English. You get a lot of people like that in the UK, especially,
Oh,
and
definitely.
yeah, I think they spoke German or something. I can't remember what language it was now. I think it was maybe Spanish. But anyway, they spoke a language that we didn't really understand, and there wasn't really a translator on in the ward either. So we were trying to obviously get to the patient. They spoke very, very like simple English, like oh me pain here, here, this, and you could tell that he was a bit distressed, And so what happened was a few minutes later, um, a doctor comes through and he speaks the language of the patient. And once that doctor said, "Oh, hello, how are you? I'm Doctor This. I'm here to assist you. I speak your language, this and that." You could see like his eyes just open, for, like full of like hope and happiness, and he was like exhilarated to see the guy there. And because of that, now the patient was communicating better. He had positive attitudes. He was more willing to engage with the doctors and take on their advice. So yeah, that was a perfect example that I remember, and I'm pretty sure there's other examples as well, where how positive attitudes of the doctor and the connection as well. You have to have that patient doctor trust and that connection, and you need to build rapport with the patients as well. I mean, I think this has been emphasized quite a lot in our OSCEs as well. I don't think everyone's taken up on this, but we always get told, okay, don't sound like a robot. You have to build rapport with the patients, and everyone like tries to force themselves to build rapport with the patients. But oh, so how's the weather? How did you get here? But It's a very important point. You have to build rapport with the patients. I mean, it's kind of hard for us because in an OSCE setting, we're under a time limit. You got doctors looking at you. It could be the reason why you pass or fail the year. So obviously, we're visibly stressed out. But in the clinical setting, I think it'll be a lot easier to connect with the patients. And obviously, if you have that in mind, that this patient doctor connection is very important, and you have to bring positive attitudes as well, and that directly affects the patient's attitude towards you as well. So that's very important. So yeah, I mean, do you have any stories of good doctors or any examples of where doctors were good or bad?
I mean, obviously, within the UK, the NHS, as we all know, it's struggling in the sense that it's difficult to get a doctor's appointment, and even when you do, you can only see them for around 5 to 10 minutes before you're asked to move on. And even once I went with a few issues, and the doctor said to me, "Sorry, we only have time for one issue." It's
Mm,
from a patient's point of view, I can imagine that that's not very, encouraging, where you feel your problems and your issues aren't being met. And I feel
yeah.
a huge contributor to the way I felt after that consultation was what we've just mentioned, was that the doctor, I felt, didn't have a positive attitude. I felt
Yeah.
he was more blasé towards the fact
Mm,
that, you know, he's got 100 patients to see. Me, I'm just another one in that 100. He just needs to tick a box on a list, see that he's seen me, then he can move on. And that, I
yeah.
felt, didn't improve or even help my trust towards him. And if anything, I
Mm,
walked away feeling a bit, down about it. So obviously, as up and coming physicians and doctors ourselves, you and
yeah.
I think it's something that we'd have to work towards. Again, it's not necessarily the doctor's fault. He's in a system that doesn't support him or her. But
Yeah.
hopefully, if you start working towards that internally, it might help externally and in the wider systems. But yeah, I mean, you can't discredit the doctors because obviously it's a high pressure environment, like we've said, and so there's so many different aspects that go towards, fostering an important and working relationship with your patients. So yeah, something that we could all
Yeah.
work on, I'd say.
Do you think that the negative attitude of some doctors is related to the long hours and underpayment?
Yeah, I mean, with any work that you do, not even medicine, long hours, low pay can all contribute towards an overall ill feeling from the doctor. Even say, for example, like there's so many different careers out there that are all facing similar issues. Look at doctors, look at teachers, any government job. A lot of them are working long hours with low pay, and
Mm,
ultimately, as a human who really wants to be doing long hours, you're getting complaints from patients, from other colleagues, administrative staff. It all, contributes towards ill feelings from yourself to patients and patients to
yeah.
you as well. So yeah, completely agree with you there.
Yeah, and I feel like it's something that's unavoidable. Like we're gonna have to do long hours, so whether you like it or not, you have to get used to it, and you have to build that resilience and that mental capacity to be able to work these long hours and still be able to bring a positive attitude to your workplace as well. And I feel like med school it sort of does help us with that because we're being pretty much forced to study long hours, and especially for exams, people like me personally, I was on one meal a day. I was starving. I was only eating when I was like really really hungry and I really needed to, and I was on like 4 hours of sleep. And you've told me this numerous times as well that you've had to study insane hours for like a certain exam. And to be fair, I think this sort of sets us up to become good doctors as well, because if we can overcome this and if we can still pass these exams with good marks, then we can work long hours and still become a good doctor as well. So I guess it helps you become a stronger person being in med school. Yeah, I mean, how's your med school experience? Do you think it's pushing you towards becoming a good doctor, or do you think it's still quite early on in your career?
I mean, I agree with you in the sense that long hours, being kept awake, all essentially, it's like a callus. When you go to the gym and you're lifting, the first time your hands are sore, but a few months on, your hands aren't sore because they've calloused towards it. And I feel physically and emotionally, these long hours can callous a person towards them being resilient and almost numb towards these long hours and emotional stresses that doctors face. But
Mm.
how I feel is that, like, as doctors, you almost dedicate your life towards serving others, but it's important to serve yourself as well. You don't necessarily want to, just because you can, you don't want to burn yourself out. And
Yeah,
because I think there's only so much a person can take before they break, and we see this time and time again. If you look at the suicide rates in doctors and even in those like the police, in the army, they dedicate themselves towards a greater purpose, as I say. But a person can only take so much. So I feel it's important to always, take time for yourself. I like to play on my PlayStation. I like to go to the gym.
yeah,
That for me is something that I enjoy doing, and I always tend to find myself finding time to do these things, because if I didn't, I mean,
yeah,
I can't imagine what would happen. And I'm sure you have your own things. I know that
yeah,
you like basketball. I know there's a few things that you
yeah.
like towards, taking care of yourself. So again, not to go on, but it's important to take care of yourself as well
No,
in these
absolutely, man.
settings.
Yeah, yeah, it's important. It's important because in medical school as well, you don't really have time to, especially during exam season, you don't really have time to ring back home, phone your parents, and you sort of have to tell your mom, "Oh, I'm sorry, mom, I can't call today." Or even when you do call, it's like a small 5 minute call. "Oh, sorry, I have to study now," and you don't really stay in contact with your friends as well. Like it's so hard, and you sort of feel bad as well because you wanna connect with your friends back home, and you just can't because of the workload, and I just feel bad sometimes. I don't know if that's the same case with you, but for me, I feel bad. Like I'm not reaching out as much, but it's not because I don't like you guys anymore, or because simply because there's so much work to do and I need to concentrate. And if I don't concentrate, then I'm probably gonna fail. And I can't afford to fail anymore because you probably heard my first episode. I've already lost like 4 years, so I don't really want to be coming back another year just because I wasn't studying as hard. But my friends know this. I mean, I'm sure they'll understand me as well. That during exam season, especially, I'm quite reserved and I don't really answer messages or pick up phone calls or any of that stuff. But after exams, I try to reconnect with people, and they understand. Alhamdulillah, I've got some good friends. You, Maher, everyone. There's a few other people from different countries from all around the world as well that do understand me, and they're very good friends. So yeah, and they're very supportive as well. The important thing is your friends. They should support you. They're not should, but it's good that they support you. Um, so yeah, that also helps. Do you think that how are you with your friends during exam time and stuff?
I feel everyone feels and deals with stress in different ways. I think I deal with
Right.
it quite well, in the sense that even if I've got a large workload on, I tend to still, be able to speak to friends, speak to family. For me, family is important. If I'm not speaking to my family at least once a day or once every other day, I feel bad in the sense that I'm not updating my parents as to what's going on in my life. So, like I
Yeah.
said, I deal with stress quite well. I'd say everyone deals with it in different ways, and so yeah, it's
Mm.
important to stay in contact with people. Eat well, exercise, do
Yeah.
whatever you need to do to be able to deal with the stresses that you have from exams and that type of thing.
So do you think you have like good organization skills, like time management skills, especially during exams as well? Do you have time to eat well and do exercise and go to the gym even during your exam period, or does it sort of decline during these periods?
I mean, there's always a natural decline in exam season. However, I feel preparation is important. For example, if I have a few days between exams, I tend to cook enough on the first day where I'm able to last with food that I have for the next few days, so I don't need to be looking for food or ordering food or going out shopping. So I feel if
That's what
preparation is
I do a
important.
lot. That's what I do a lot. I order food every single day during exam period. And my dad's like, "Oh, where's your money gone?" I was like, "Oh, dad, I'm really sorry. Like, it's exam period, so I don't really have time to cook." So I'm like, sometimes I'm spending like £100 over my budget. And I'm like, it has to be done because otherwise I'm wasting time with cooking and stuff. So it's good, to be honest, that you can manage your time effectively. Time management is another quality of a good doctor. So there you go.
Yeah.
So yeah, I mean, that's all, guys. That's all the points that I wanted to cover for you guys. So just remember that being a great doctor isn't just about knowledge. It's about empathy, integrity, time management, resilience, having a positive attitude towards life and in the world as well. So, and you should always have this mentality of trying to improve yourself like every single day, because as you know, medicine is a lifelong journey. So, and if you're not ready to embark on a lifelong journey, then medicine is probably not for you. But there you go. I mean, thank you, Umar, very much. It was good to have you on this episode. And if you enjoyed this episode, share your thoughts and drop a comment. I don't know if you can drop a comment on this thing, but if you can, then do drop a comment. But yeah, thanks for tuning in to Global Med Talks. Until next time, keep learning and stay curious. Peace.
Bye.